Thank you. Thank you very much. Thank you very much, Aaron. That was very well presented. I mean, it's so simple, but some of it's very much a common sense approach, but yet, sometimes we forget those things. And it's really helpful that, you put it in succinct terms for people to understand. So thank you so much for that. Before we take questions, joining Aaron on the panel is Rajesh Shah. If I can just quickly give a background for Rajesh. Rajesh's background is in the construction and house development industry with core skills in commercial and property management. Currently, he is providing a non-executive governance role to Grand Union Homes. He is also developing small-scale housing projects. He was the managing director of Tay Homes Midlands Limited, a regional operation of Tay Homes PLC. So let's get on with the first question. If I can actually ask Aaron, please. Thank you. Aaron, what about the airline industry? Does that come under different guidance, or is there a general guidance for them?
They will have their own guidance, and there is specific guidance for the airline industry. Now, there hasn't been any published guidance I've found on the government websites relating to the airlines, so I wouldn't like to comment at this stage on anything specific relating to to the airline industry. Yeah, that's
Sure.
That's all I can say, I'm afraid.
Okay. No, that's helpful to know. Shandip, yeah, question.
Okay, so question to Rajesh. What powers do local authorities have in guiding businesses back to work? And what enforcement action can they or do they take?
Oops, hang on. You're muted, I think.
Okay, can you hear me now?
Yeah, we can now.
Yeah.
Okay, there are actually special powers now being provided to local authorities regarding COVID-19. But in real sense, the Health and Safety Act and the powers behind it are the guiding sort of rules and requirements for health for any concerns regarding COVID-19. And in terms of enforcement action, is the HSE that really does that. So really, local authority would give you some guidance, but in terms of the actual powers, that would rest with HSC, as far as I'm aware of.
Perhaps, Aaron, you can come in.
Yeah, if I can just add to those comments. So definitely there are powers available to local authorities. So under the health protection coronavirus restriction regulations, then that allows for fixed penalties to be given to members of the public or to individuals concerning sort of gatherings and movements and the restrictions placed. There are also restrictions on businesses which both the local authorities can enforce as well as the HSE. But perhaps what I would say there is that during this COVID-19 pandemic, the HSE, they have been given an additional £10 million in funding to recruit more staff for their helplines. So they do have a helpline which is available both to employers and employees, where you can actually get guidance from them. Now, I think from what I've heard so far that a lot of employees have accessed that, and really just to get information whereby they're not happy about going back to work, and making sure that their employers are doing everything possible to make it safer. And there's also powers both local authorities have and the HSE in terms of enforcement. So they could either serve you with an improvement notice if they require improvements to be made, or if they felt that there was an imminent risk of personal serious injury, then they could serve you with a prohibition notice or even take you to court. Yeah. So there's quite a lot of powers available to them.
Sorry, Aaron, can I just follow up on that one? Can the councils, the local authorities, can they issue fines for breach of COVID-19 guidelines, regulations?
Yes, they can. So the sanctions and penalties are more geared towards individuals, and they are fixed penalty notices, yeah. And that's really about restrictions and movements. And also there is regulations in those about inciting gatherings. So, but they're mainly aimed at the public, hence the reason why they are public health regulations and not made under the Health and Safety at Work Act, yeah. Mm-hmm. But local authorities and the HSE, they could come in if they felt that you were ignoring the advice, or perhaps if you had opened up your business when you weren't supposed to, then they do have the powers to take you to court. And indeed, not only that, within the regulations, it also allows any authorized person by the Secretary of State can take action as well.
Thank you. Nirmal?
Yeah, this is again for Aaron. Aaron, a question. I'm actually going to put this in 3 parts because it all relates to employers. Employees. So, can an employee refuse to work where risk assessment has not been done for COVID-19 and all the implementation of the government guidelines have not been put in? And the second one, again, based on employees, is if an employee refuses to wear a mask in the office, what can the employer do? So, but both related to employees, actually. Yeah.
Okay, so let's answer that one first. So we're talking about employees. If a risk assessment hasn't been completed, can they refuse to come back to work? So for some employers, they may well have less than 5 employees, so there's no legal requirement to undertake a written risk assessment, yeah? Now, every employee is entitled to work in a safe environment. Now, normally, if you follow the risk assessment process, yeah, and particularly if you consult with your employees, then that normally would be adequate. And so in answer to your question, the answer to that, can they refuse? Then no, not if you're doing everything that is reasonably practicable to reduce that risk to the lowest level possible, yeah? Now, what they can do, so I had this with one of my clients, and then the person didn't want to come back to work, so the employer offered him either unpaid leave, yeah, or he had the option to use up any holiday, or if he still wasn't happy, he has got the right to go to the HSE, and there's a HSE information number and an inquiry form which you can get from their website and take advice from there. And now if that was to happen, the HSE would then make inquiries with the employer and kind of say, well, either the procedures are adequate or they may need to make improvements, yeah? So in essence, they can't refuse to work. I think the most important thing, and this is stated within the guidance, is that you cannot eliminate the risk of COVID-19 completely, yeah? What the law is asking businesses to do is to reduce that risk to the lowest level possible, yeah? So I think that's the first part of the question answered. Remind me on the second part, Nirmal.
Yeah.
Mask.
Okay. The second one is basically on if an employee refuses to wear a face mask. in an office environment, so I'm assuming this is where presumably they can't have that 2-meter social distancing. I'm assuming the question is based on that. So if they don't have the 2-meter social distancing space, then so a face mask is potentially a requirement, and the employee refuses to wear that, what can the employer do?
Well, they would be perfectly entitled to take disciplinary action against the employee, because what you are asking them to do is you are providing them with personal protective equipment, which is a requirement for the job and for their work. And if they refuse to wear that, then they would be in breach of the safety guidelines, yeah? And not only would they be putting themselves at risk, but other people at work potentially, particularly if they were symptomatic carriers, yeah? Now, that would that would be potentially a disciplinary action, and it could result in the dismissal. Now, anything, when I talk about dismissals, and I would always say a caveat, then you must refer to proper HR professionals for advice on how you would go about that. But in essence, if they've been requested to wear a face mask, yeah, as part of their work activity, then they are obliged to do it.
Okay. Aaron, just one other thing. So, we spoke about the assessment part before. Now, is your mode of travel to work also part of the assessment? So let's say if an employee is traveling and needs to use public transport or things like that, is that taken into account when your risk assessment is done?
No, well, let's clarify that. So strictly speaking, the employee has no duties when their employers are traveling to work, because it's not considered work's time. However, as part of your risk assessment process, and when you're bringing employees back to work, then one of the things you need to consider is, can they actually get to work? So for some employees, or can they get to work safely? They may have to rely on public transport. There may well be restrictions in public transport in terms of the frequency and the operation of those services. So that could have an impact on the suitability of that person coming back to work, yeah? But yeah, from a legal point of view, employers are not responsible for their employees outside of their work. It's only, so if the employee had to travel as part of their work duties, then naturally they would be responsible, yeah?
Okay, thank you. Aaron, I've got a three-pronged question again. Sorry, it's more to do with employees rather than employers. Basically, if I think it's more of an employer question. Sorry, the first bit is: can an employer ask pregnant women and others who are clinically vulnerable to return to work if they can't work from home? That's the first bit.
Sorry, can I just answer? It's
yeah,
my
sure,
age,
please
I'm
do.
afraid.
No, carry on.
I'll just answer the one question at a time, if that's okay. So,
yeah, sure.
Firstly, if you are clinically vulnerable, then yes, the employer can ask them to come back to work. However, they may well need to make adjustments to their work activity. And certainly that would include things like looking at individual risk assessment. So depending on the type of vulnerability. So even under existing law, we would undertake specific risk assessments for young people, which are under 18, pregnant and nursing mothers, and also people who may be classified as vulnerable, who traditionally may have learning difficulties, they may have they may have problems with movement, etc. So you would need to take a risk assessment for them. What they're not allowed to do, or what you should avoid, is for anybody who is classified as vulnerable, clinically vulnerable, and that's people with underlying health conditions, then they should not be allowed to work in a situation where they can't maintain social distancing of 2 meters. Yeah. Okay, so that's the first part.
Second part is, obviously, if people can work from home, can the employer force them to go back to work, or can they terminate employment if they don't?
Yes, they can force them back to work. However, the guidance is that you should enable your workers to work from home wherever possible. Yeah. So if you decide you need that employee back, yeah, then really they should be coming back to work. However, once again, as part of the consultation, businesses want to be working with their employees, yeah, and it's all about flexibility on both sides, and that flexibility is based on the business needs as well as the employees' needs, yeah. So I think we need to be reasonably sympathetic to employees. You know, they may well have, you know, within their households, they might be living with vulnerable people, and it must be quite difficult when you're thinking the last thing you would want is to go to work and inadvertently come back to work having caught COVID-19 and then bringing that in and infecting other members of your household. So I think we've got to be very fair-minded on both sides, yeah. And I don't think it would work. We don't want to be getting into arguments, you know, it's working together.
Yeah, and then the third prong of that question was obviously same thing. But if somebody's over 70 years of age, you know, can they go back to work if they don't have any underlying conditions, I guess?
Well, once again, so yeah, I think they can come back to work. So I would suggest that they would need to check the latest advice on shielding, because that has changed now. So they are able to come back to work, but once again, they are going to be more at risk, and certainly they shouldn't be undertaking any work activities which involves working at a distance of less than 2 meters. Yeah.
Yeah. Thank you. Chandip?
Thanks, Rohit. Again, sort of 2 health-related questions, and I'm going to ask Rajesh for this, or both of you. First, on the dental side, how does a dentist operate in the absence of the 2 meter social distancing rule?
Okay, shall I go first?
Yeah, linked to that question, and this may be, again, something else as well. Is there a need for a special visitor questionnaire or form for COVID-19 questions?
Okay, you mean to say for the dentist or generally?
No, generally for their patients.
Okay. Right, on the first one, the dentist actually, dental practice is probably one of the highest risks in terms of, you know, being near patients and being in I suppose, a position where real, very detailed risk analysis, a risk assessment needs to be undertaken. So the key thing, and actually dental practices have been, you know, I think the guidelines given by the dental organization, whatever it is. However, the key thing really is that the correct type of PPE is to be utilized. There needs to be a process in terms of how many patients can be seen, but very deep cleaning processes in place. It's something which I think a risk assessment needs to be taken in consultation with the rest of the staff. So it's not just the dentist, you know, it needs to be done so that everyone within the organization or the practice is aware of the safety precautions. In terms of patient numbers, that will probably fall dramatically. So if a dentist sees, say, 10 patients an hour, that will be reduced substantially because of the time taken for precautions, and so the numbers that they'll be booking in will then change. So that's the first part, I think, and I'm sure Aaron may want to add to that in a minute. Now, just remind me on the second part.
The second part is having a questionnaire, either for clients or patients, and asking them COVID-19 related questions.
Oh, I see. What health-related questions? I suppose they're the standard questions which would provide signs for possible COVID-19 infections, temperature, you know, and anything which, you know, the guidelines keep changing, because at some stage you probably may have noticed people's tastes, for example, if that taste had gone. So I think this is one thing where Aaron mentioned, you've got to be up to date in terms of what information, changing information is coming through. Temperature on its own is not necessarily an identification. And, you know, some people may have COVID-19, as we said, and there won't be any signs. So it's a very difficult one to actually manage.
If I can just add to that, so perhaps what I would refer them to is that there is specific guidance for clinical settings, which is available from the website, and most of that will refer to healthcare settings. But the procedures that they should already have in place concerning infection control should cover most of this with COVID-19. So whenever you go into a dentist and they do, you know, they have strict sterilization procedures, all of the equipment is brand new for each individual patient. And I know certainly in my dentist, I have to fill out a health questionnaire every time I go in there, even though nothing's changed, but I still fill it out. You know, once again, it also comes back to, well, I would say this sort of social responsibility, whereby, really speaking, if people do have a high temperature, a new or continuous cough, or any other symptoms related to COVID-19, then really they definitely shouldn't be venturing out into those environments anyway. And ideally they should be shielding. So yeah, in answer to your questions, follow the guidance for clinical settings. There is dental associations, and most dentist practitioners will be members of that. So they should be able to take specific advice. But essentially, I think for most of them, it won't be a great deal of change from their normal infection control procedures.
Yeah, excellent.
Nirmal? You're muted, hang on a second.
Sorry. Again, I think let me go to Rajesh for this one. Rajesh, if an employee who is actually, let's say, for example, working in the IT sector, and the employer asks the employee to visit a client site, and there's no information on assessment done at that site, what is the expectation from the employee? I mean, who handles the risk at that point?
Yeah, I think, again, common sense would have to apply, and what will happen is there needs to be some consultation in terms of if the employee needs to travel to another site and to visit a customer somewhere, a discussion should take place in terms of what and how the facilities, what the facilities are, and if there are any precautions required for those premises. So I think the same responsibilities will be there as employers' responsibilities for a visitor. So if you've got a visitor, we've got to make sure that the person that he's visiting should provide some information regarding precautions and some guidelines. Now, if there isn't, then the employee could again discuss how this can be improved. So he can discuss with his employee, the first, the employee. But really, if he feels or she feels that there is an issue, then I think a discussion with the employer, and maybe they can take a view on it. It's common sense, really. It just has to be through a process where hopefully some sort of a great arrangement takes place.
Okay, thanks. Actually, can I just ask one other question related to workplace? Now, Aaron, this may be for you. If businesses are spending all this money to put in the necessary steps to return back to work, there is a cost involved in this. Is there any sort of government assistance for businesses where they have funds to actually get back into normalcy by putting in all of these restrictive steps? So the question is there any government funding available to businesses to actually do this kind of stuff?
So as far as I'm aware, there is no government funding, but what I would say is that really when we look at the cost and the control measures, they don't have to be overcomplicated or expensive. Now, the example, I went to Aldi the other day and they were looking to introduce a traffic light system on their doors, so it was linked to their CCTV cameras and it all looked very expensive. Yeah, I went to another local plumber's the following day and all they had, and it worked just as well, was a sign on their door which limited 2 customers at a time. And because they were plumbers, they very simply just erected a barrier which was 2 meters or a meter away from their desk, made out of old pipework, which would have been no cost to them. So when we look at the control measures, most of it can be done very, very simply. They don't have to be expensive. I've talked to some of my other big clients, and these are huge organizations, hundreds of different branches throughout the country. And I said, look, you don't have to overcomplicate it. Yeah. So, you could look at just very simple measures by signage. And that's probably one of the most important things, reinforcing that message of social distancing, having increased hand washing and hand sanitation stations. So yeah, there's a small cost in providing additional sanitizers, but they don't have to be over elaborate, and that's always been the case.
Okay.
Aaron, you have actually provided some information that we will be putting out on YouTube, which is going to be very helpful for people just to review and look at. Its material that they should look at if they're looking at assessments, etc. And I think in that pack, there is a risk assessment checklist for people, and that needs to be obviously, used in the first instance by everybody, and then pare it down to what their sector is, etc. Is that is correct, isn't it?
That is correct. So the risk assessment is essentially, it covers all of the sector-specific guidance. And as I said at the very beginning, the sector-specific guidance, it doesn't change. All they've essentially done is change the photographs, yeah?
Okay.
So within, yeah, it's a government thing. So within the risk assessments I've provided, it follows those steps. And within the bold sections, I've just asked people just to insert their own local procedures. So that might be simple things. Where are your hand sanitizers located? How many people can you fit into a meeting room? And it might just be saying maximum occupancy 4 people in this room. You could just very simply write that on a piece of A4. So it's very simple things that you can put in place. And it's a question of turning those considerations in the risk assessment, which are also in the guidance, into what each individual business is doing, which is going to be suitable for them.
And as I said, what we will be doing is we will be putting this on our YouTube channel at some point shortly, and also presumably on Facebook, Nirmal. I presume we can put that.
It'll go on Facebook.
Yeah. Okay. Thank you.
Yeah,
Just a follow-on question was from there is that, you know, you mentioned something about where if we have over 50 employees, where they publish this stuff on the website. I presume it's the employer's website that they need to publish this on.
Yes, it would be. So yeah, and that only needs to be really what I would suggest is the significant findings. And obviously, if you make sure you don't put any personal detail of employees, so we're not breaching any data the Data Protection Acts. And the second thing to add on that, which I forgot to mention, was if you follow the guidance, you can actually print out a COVID secure sign which says you've gone through these various steps. So I think it was on slide 5 of the presentation. On the right hand side, there's a little thing which you can print out from the government website, and I've noticed already that some companies are already displaying this. So when I walked past Wilko's today, or Wilkinson's, they had it on their shop frontage that they've gone through this 5 steps of the risk assessment process, and it's been signed off. So that's something you can put quite simply, which will give a lot of reassurance to perhaps your employees and also customers if they're coming into your premises.
Yeah. Shandip?
All right, Rajesh, a question for you.
Mm-hmm.
Can office-based companies, so company asks visitors to offices for a brief history of individuals' travel habits and their health status, or is this contravening the Data Protection Act?
Wow, that's an interesting one. If they're valid reasons and if it's limited information, you know, if you're talking about information which can be shared sensibly, then I suppose they can. I mean, I'll give you one example. If people have just come from, say, overseas and possibly from an area where COVID-19 is prevalent, then you know, they should be declaring that, you know, which they would possibly when they come anyway now. And if they, you know, travel back to UK, they'll be placed in some sort of seclusion for 14 days. However, you're talking about offices now. So are you saying that if somebody travels from travels to an office environment, can an employer ask regarding how they travel to work? Is that the question?
If I can just add to that, so I think one of the things that they're looking at now and where it may well be relevant is where the NHS have now introduced a test and trace service. So if you have had close contact with somebody who has now tested positive, then it would be reasonable to ask for that information so that you can actually trace them, basically. So if you are having visitors who are coming into your premises, then it's a good idea to log them in a visitors book anyway, simply for fire and security matters. But obviously, if you're having these meetings and somebody's come in, so if I come into your premises and then a couple of days later I've found out that I've been infected or I've been tested positive for COVID-19, they would want to know who I've had close contact with. So there will be a lot of occasions where you do need to keep records in order to comply and help, once again, for this test and trace.
Okay. Can we have one last question, which I'm going to give you, Aaron? If this is basically, we've had 2 or 3 people asking the same question, where employees are asked to work from home and employers are requiring them from working from home because of the COVID-19 crisis, does somebody have to do a risk assessment at the employees' homes, and who has to do that?
Well, that's a very good question. So certainly at the beginning, when this first started and the infection started rising and they brought in the control measures and asking people to work from home, then it was, employers didn't have the opportunity to undertake risk assessments or home worker assessments. So I think within the pack I've given, there is advice on home workers. So a lot of people ask about display screen equipment and the use of computers at home, and do you need to undertake a full DSE assessment for when you're using your computer at home? Now, the guidance from the HSE at the moment, the answer to that is no. So I've provided guidance for home workers. So at the moment, I would classify the arrangements as temporary, so there would be no need to undertake a home worker's risk assessment. Yeah. Yep. However, if it's likely to be on a permanent basis, then, or certainly if staff are now going to be contracted to work from home and it's in their contract of employment, then I would suggest you have a home workers risk assessment in place. And even without the risk assessment, one of the big things with people working from home is this this isolation and a lack of contact with fellow workers. And that can have some really serious implications. So it's a big thing to address. And once again, I think within the guidance I've submitted, which people can download, there are a home workers checklist which they can use for any employees.
All right, I'm afraid we've actually overrun by about 5 minutes, and I apologize to everybody. But we do have a lot more questions in our chat, and what we will try do afterwards is we'll get Aaron and Rajesh to answer these questions, and we will add an addendum to the video that will go on to YouTube. So you'll be able to see the answers on that, and we'll try and make sure all the questions are answered. I mean, obviously, if they aren't, then you can always call us on our business helpline, and we'll try and help you from that. But can I just finish? Before we finish, I'd like to thank Aaron extremely, very, very much so, for a great presentation, and both Aaron and Rajesh for a very, very interesting panel session. And I think this is a topic that I think people will now be able to go away and think a bit more about, which obviously it'll help them in terms of their businesses or whether they're going back to work. So again, thank you both very, very much for this information. I'm sure everybody found this very helpful, and like I said, it's going to be recorded and it'll be on the YouTube channel. And also this other information that Aaron has given us, there's a pack of information. We will put that onto the YouTube and the YouTube channel and the Facebook page for that, so people can just log in and download things from there. With respect to helping the elderly, the vulnerable, and those in isolation and key workers, this is our helpline, which is on the screen at the moment. So please, if anybody needs any help, ring us on that helpline. And also, if you need any further information about today's webinar or any of our other webinars, please SMS us or call or put a WhatsApp or call us on this number. We will basically be circulating the helpline number and the YouTube link by email to a lot of the attendees, which you'll have already seen. Our next webinar is Assistance for Charities and Charitable Trusts, which is tomorrow at 3. So in case you haven't registered, please register, and you're more than welcome to join us. We then have other webinars on Sunday the 14th, as I mentioned before, and Wednesday the 17th, which are also up there on the screen. So you should have received an email. Please register for these, and we really do look forward to welcoming you all. If you have any suggestions for future webinars, email us at cat8webinars@gmail.com, and look out for the education series that's going to come out very shortly. So for tonight, thank you for attending today. Be safe, stay alert, control the virus, and save lives. Goodbye.